let us have a quick look at how the lower end of humerus and upper end of radius and ulna are modified to form the elbow joint. Now, the lower end of the humerus, so now look at the views. So this is anterior, posterior, ulnar and radial view. Now here in the AP view, the elbow joint is in extension, and in the lateral view, that is ulnar and radial view, the elbow joint is in flexion. So now let us have a quick look at the AP views. Okay, so in the anteroposterior view, so this is anterior view, you can see very well make out the distal end of the humerus is modified to form a rounded capitulum and a pulley shaped trochlea. So the rounded capitulum is accommodated by the radial head, which is discoid shape. So that is all about the radial aspect of the elbow joint. In the ulnar aspect, there is a trochlea or a pulley which is at the distal end of the humerus, which is accommodated by the ulna with the formation of a notch. This notch is obviously called as a trochlear notch. What you see in front is the anterior process of the trochlear notch, that is called as a coronoid process. Now just have a quick look at the posterior view. Here what you see is the olecranon process. Olecranon process is the posterior part of the trochlear notch. Okay. Now next thing to understand, can you make out this olecranon process is when the elbow is in extension, this olecranon process is occupying a fossa behind the humerus. Yeah, this fossa is naturally called as the olecranon fossa. So at extension, when you do the extension, the olecranon process lodges inside the olecranon fossa. Otherwise, the olecranon fossa is in the humerus, and the olecranon process is a part of the ulna. Alright. Now let us look at the ulnar view here. Now in the ulnar view, the elbow has gone to a flexion. So when the elbow flexes, can you see the anterior notch of the anterior process of the trochlear notch? So this is a trochlear notch, and this is the anterior process known as the coronoid process. You can make out this is the posterior process known as the olecranon process. Now the coronoid process lodges into a fossa in front of the humerus known as the coronoid fossa, which is shown here in front. See, so this coronoid process lodges in the coronoid fossa, which you can see when the elbow goes to flexion from the ulnar side. Okay, so by and large, what you have to understand at the end of the day is processes, that is the forming the trochlear notch, are present in the ulna, that is anteriorly the coronoid process and posteriorly the olecranon process. Okay, now fossas to accommodate these processes are located in the humerus. For example, in the anterior view, you can see the fossa to accommodate the coronoid process is known as the coronoid fossa. In the fossa and the posterior view, the fossa to accommodate the olecranon process is known as the olecranon fossa. One more fossa you can make out in the radial aspect. Can you make out this fossa, which is to accommodate the head of the radius in complete flexion? So that fossa will be obviously named as a radial fossa. Thank you.